LHP, which means or stands for the Leaders for Health program. It's a tri-leader capacity building intervention focused on the health sector. We call it a capacity building intervention because really the main intervention or currency that we brought to the partner communities is really training, capacity building through workshops and through a degree program for the doctor to be able to help them reshape the way they think about health, the way they feel about health, and the way they act on health. No matter how much resource, money, human, material resources you pour into a health system, if the different stakeholders of the system are not aligned in the way they understand health, then what will happen is that the resources will be pulled to different directions by different people, and that's no guarantee that indeed that is the correct way to understand health.
The intention of the Leaders for Health program is to improve the access to basic healthcare facilities and services of underserved Filipinos. So it's a tripartite partnership with Pfizer Philippines, Department of Health, and Ateneo. The intention there was to highlight how important is the public-private partnership when you want to solve public health issues. It's a holistic program that we get skills training, capacity building training for the people who will run the program, plus we have actual community service.
Because it was really developed using or with the model of the Doctors to the Barrio as a context.
DOH from their current program in DOH na Doctors to the Barrios, it was innovated to become the Leaders for Health program. So, Doctors to the Barrios program plus an LHP.
Our beneficiaries are what we call the tri-leaders, meaning to say that our definition of the leader in health is not the usual. People always think, pag health yan, doktor yan. We agree that the doctor is an important player because in a sense, the doctor has the technical know-how.
We see to it na we engage in the whole executive administrative function of the municipality.
Aside from the doctor, there are decision makers or political leaders, especially in the setting of local government units, who actually hold the control knobs of power and wealth, who can decide to hire or fire a doctor, who can decide to put 2 million or 200,000 pesos on the health budget because they are the local chief executive. The third group are the users of health, everyone, but they are represented by community leaders who are elected formally or informally by people's organizations, and they are seen to be the ones to connect to the beneficiaries.
Ateneo is the provider of education.
We wanted to offer a doctor, make it worth his or her while to offer a degree, to go through to school again and earn a degree in the process. And the degree is called a Master in Community Health Management. For the local chief executive and for the community leaders, they undergo a similar program, but it is not a formal degree. They get a certificate in community health management, the design of which stems from the formal academic program.
DOH naman provides the technicalities of our work in the municipality. DOH part helps in the selection of the municipalities. They do the matching.
Their main role was really to provide the funds. Pang gasolina talaga sila.
We help both in the funding and the program development. So we're very much an active partner in these kinds of programs.
And so what Pfizer was able to support was the completion of the first batch, 4 years, and half of the second batch is 4 years.
Total investment in Pfizer was 50 million.
There's never enough money. Number two, well, the doctors go through their own issues as well, no? I mean, because they are not organic in the communities, and and they get disheartened kasi they are far away from their family and their loved ones, and they are in the most remote areas, and sometimes they don't have the support of their mayors. Had our share of that. Some we were able to transfer, some we were able to talk out of it and ask them to stay. But others had to go. And of course, there were areas where the mayor was just totally uncooperative. And if the mayor is totally uncooperative, we back out it. Because it's not gonna work eh. Pagka nalalagay sa pakanibang doktor namin, ayaw na namin. Kailangan pull out ka agad yan. Delikado eh.
Pagdating doon, ako naman kahit na hindi talaga siya yung excited palagi. So pagdating mo doon, it's not really yung condition ng mga tao, hindi talaga yung disease, but the condition of the health system. Yun ang makikita mo na pagdating mo doon, although bago renovate yung RHU na napuntahan ko, nakita mo talaga yung lack of supplies. Kahit na yung patient start, it has bond paper. So, doon nasusulat yung mga nasa wala pang format, have bond paper. So, yun na yung patient start. Tapos, bakit ka nakakasipin? Kasi wala na supply ng tubig. Tapos, wala na. Pagdating ko doon, wala na rin gamot. Siyempre, ang unang tanong mo ako, saan yung may budget pa? Hanap ako ng budget, basta ako sa munisipyo, so may budget. Wala na talaga. So, ang budget lang pala for supplies for the whole year is 20,000. Okay? For the whole year. So, dumating ako doon ng September. So, wala na. Ubus na. So, hindi na rin talaga makabili ng supplies. Tapos, medicines, syempre, kung third, fourth quarter na yun, wala na rin. So, nung year na yun, 2020, kasi nagalit na yung mayor ko sa akin. So, hindi niyo ako pinapansin, hindi niyo ako kinakausap. At makikita mo talagang wala yung support. Ang maganda doon sa NHP kasi meron kaming tri-leader, may mga workshops. Yung time na yun, hindi siya ma-attend din ng tri-leader workshop.
Main problem here is really with for the doctors working with the local government officials. Because while they you start from the same point, but when you go down to the local government, to your own municipality, it depends on the priorities of the local government officials. There are those that the doctors and the mayors and other local government officials, they agree that that is a priority, but there are some areas that need to prioritize other areas. So that could be a challenge, especially for the doctor volunteers, if not much attention or funding is given to the project. And it's a normal challenge even for other programs, whether in education or even when go na the LGU, there are challenges with the local government.
You cannot claim full credit. Health is multifactorial. But we can claim some credit.
I think certain lead actors na natap ko dun sa municipality, I have the confidence na they will not stop working for the betterment of the health system sa Katipunan. Kasi they experienced the total new breed of health system and really help design a focus for them. We engage them to have a mission and a vision for themselves. One of our project na put up dun sa Katipunan is the new municipal health office with a line-in na siya. Tapos, na-Centron Sigla siya, certified, plus na PhilHealth accredited.
2007, we have exited from the program. Like, the program is still ongoing on the Ateneo. So, I guess right now it's open to other partners, funding partners. The course is still there, so I heard that they still intend to push through with the program. Pfizer Foundation implements programs with partners. It's basically to help them start a program, develop their program, develop the capacity they need, but later on we do exit because a requirement is for our partners to be able to sustain the programs, whether it will be like Leaders for Health or a community health program. It should be sustained by the community or by the partner organization of Pfizer.
We will
We
still
have
see
not
LHB.
closed down our LHB office. We have just moved on to other jobs within the university. Some of us, others have gone to other jobs, but we are ready. Anytime there will be, some substantive funding that will allow us to take off. At moment's notice, we can do it. To organize ourselves again. Now we have kind of refined the model and we know we can do it in 3 years. And the intervention is really just to build a cadre of leaders whom we hope will become rooted in the community and can continue even as we move on to others. As a whole, we're still hopeful that, the effect of LHB will really only be seen if it can spread like wildfire to as many groups and communities.